focused on only one industry, fast food, but that is not the only place where workers earn the minimum wage or near it. And so leaders in other fields are warning about the potential impact on their workforces if fast food gives their workers a raise. That includes direct service professionals employed by NYSARC and other nonprofits. Here to talk more about that, we have NYSARC Executive Director Stephen Kroll, and then Susan Constantino is with us. She's the President and CEO of the Cerebral Palsy Association of New York State. Thank you so much for being here. Steve, welcome back.
Thanks for having us today.
Okay, so what is the average hourly pay for a healthcare professional of the sort that we're talking about? We're talking about home health aides.
Well, we're talking about the direct support professionals that provide the supports for people with developmental disabilities, and generally they're paid around minimum wage or a few dollars above. And these are people with a tremendous amount of responsibility. So they are not only working in the arena of healthcare, but they provide for the activities of daily living for people that need help doing it. So these are people that need help with their activities of daily living, like dressing, like eating, like getting around. So there's a tremendous amount of responsibility, and these are long-term supports. So many of these people work with the same people for many years.
So this is a sort of unusual case because we're talking about nonprofit, mostly nonprofit entities that employ these sorts of folks, but the vast majority of them are paid through Medicaid reimbursements, correct? So you would need a Medicaid reimbursement and permission from the state to increase, unlike your average private industry, to increase how much these people are paid hourly?
That's correct. We get a rate from Medicaid that includes all of the salaries as well as other things that are needed for fit folks who live in residential programs, day programs, any kind of supports that we give. And those dollars really are from Medicaid. Medicaid would have to reimburse us. If minimum wage goes up, there's no guarantee that our reimbursement would go up.
So just to be clear, even if the situation was that the legislature was poised to approve a statewide minimum wage, which we know that they are not at this moment, largely because of the Senate, there would be no guarantee that your folks, the people we're talking about here, would be impacted by that.
That's correct.
Okay, now part of the problem, as I understand it from your testimony today, Steve, is that you've already got some vacancies within the industry. This isn't an easy task. I mean, people have to, as you mentioned, it's very personal. Lift, bathe, feed. It's taxing. You have to work overnights. It's difficult, though you need training. The education, you don't need a PhD, right? Is that correct? So you're...
We have people there. We have a credentialing process that people will sometimes enter into. They all have background checks. They're subject to a significantly large body of regulation. And so the responsibility is, it's the responsibility for a human life. They're caring for people.
Yes, very important.
Yeah.
But the population from which you are hiring for these jobs is similar in some cases to the population of folks who are applying for fast food jobs?
Well, in the economic range, we're hiring people that are mostly paid at minimum wage when they begin, and then they could make some progress and earn a little bit more. But basically, the Medicaid program supports salaries in that area. So it's a tremendous amount of responsibility, and we find when people join us, they want to stay with us because it's a wonderful job. They're working with and supporting people. They become like family. But from economic advancement, there's not a lot of opportunity there. And yes, in an improving economy, we are competing with people that are going to be applying for work in minimum wage type area like fast food. And one of the things we fear is if that one segment of the economy, the fast food industry, gets a big push forward in wages, people that have worked with us for many years may have to make an economic choice. Do I continue supporting the people that I've worked with for many years, or do I go for several dollars more an hour, which can make a difference in their own personal economic circumstances? And that's why we think that we support the minimum wage increase for everybody. We're very appreciative that the governor has made it a priority, but we want to make sure that it happens for all of us at the same time, not just one segment.
So you're worried about a ripple effect, is what you're saying?
Absolutely.
Yeah, what do most of the folks who are in this industry get health care themselves? Do they get health insurance?
A large number of them do. Actually, one of our funding sources a number of years ago gave agencies additional dollars for health care enhancement, they called it, so that we could, in fact, guarantee that people would have health benefits.
So wouldn't that, though, sort of ameliorate this problem? Because most people in the fast food industry, I would say almost everyone, unless you're working for Starbucks or maybe a couple other companies, don't have health insurance. And so even if you do get $15 an hour or more, depending, you know, what the wage board does with regional increases. I mean, we just don't know what they're going to do. But you still don't have health. So wouldn't you be able to argue to some of your folks, well, you know, you have coverage. If you leave, you're not going to have coverage.
I think we can argue it, but I think in today's world, I think the argument falls a little short. They know that they can, in fact, go to an exchange, that they might be able to get health insurance at little expense to themselves, because at $15 an hour, what you're going to end up paying for health insurance on an exchange might not be significant for them. And I do believe that for many, particularly those just entering our workforce, and we are always hiring new people, the $15 will look really good. I really believe they will be a huge drain on our system.
What do you need from the legislature? Now, just to be clear, the likelihood of you getting anything from the legislature at this moment is fairly low. But let's assume that the wage board does what it does, and then next year you have an opportunity to say, well, and you probably will have numbers too. You'll know what the impact is, and you'll go back to the legislature and say, we need a higher Medicaid reimbursement, and we need what else?
Well, we are already working with the legislature, and we have legislation that has been introduced by the chairs of the respective committees in the Assembly and Senate that would basically tie any increase that is done by a minimum wage board back to human services, and that all human services professionals would receive consideration of an increase of a similar amount. And that is certainly not just our organizations. We provide services for tens of thousands of New Yorkers with developmental disabilities and cerebral palsy, but there are many other human service organizations that we're allied with and working with that provide services for many other people that have needs in the human services area through some of the other state agencies. In addition, if the legislature does choose to do an increase in the minimum wage for everybody in a future session, that would be a way of addressing it for us, as this is going to be something that could be incrementally implemented.
We touched on, just briefly before we came on camera, a really interesting point, which is that this is a top priority of organized labor. And the people that we're talking about who are not going to be impacted by the fast food wage board are, in fact, unionized folks.
Many of them are.
So they are not going to be touched if the fast food industry, which is not unionized, but the union organizations have their eye on them for potential unionization. You know, I mean, so you're sort of, you might actually end up hurting some of the very people that you represent by trying also to grow your footprint. I mean, that's effectively what the unions are trying to do, is strengthen organized labor, which has been, you know, supposedly losing numbers, although in New York it's not exactly the case. But has that been difficult?
It's very difficult because it's hard to really make organized labor understand that it's not the agency itself, whose workers they represent, that is stopping, you know, raising wages. It really is the Medicaid reimbursement that's stopping you
So you have absolutely
from
no
doing
capability of raising wages without the state's permission?
Well, the state doesn't necessarily have to give you permission, but they have to increase your rate in order to give you the dollars that it would take to do it. We currently operate on a system that really looks at average salaries, and you're given a rate that really is based off of average salaries. So to raise that in any way would put you in a situation where you're not going to get reimbursed for the dollars.
And just to be clear, I mean, is the person who's been working for you for 20 years making the same that the person is making as they walk in the door?
No.
So there's room for advancement then?
Right. And one of the things that we're trying to do is we've been already working with the governor's staff to try and look forward to next year's state budget. While we don't need permission to increase the wages, we basically operate on pretty close to a break-even margins. And we've been through many Medicaid reforms, as many of your other organizations have been through over the last several years, that looks at ways for us being more productive for less money overall. So we've been working with them to make sure that they see the same value we do in the direct support professionals, and certainly we've gotten very positive signals back from the administration in that area. But then the money has to be allocated by the state budget, whether through the Division on Budget or through the legislature. So for us, it's about really two things. Number one, making sure that everybody understands just how critical these direct support professionals are to the well-being of many, many individuals in New York State, but also making sure that there's room to pay for them, because we can't raise our prices like any other, say, fast food industry might have the ability to do.
Well, you know, we could get started on our budget talks now, apparently. We're hardly even through the legislative session. We'll discuss it again next year. Thank you so much, both of you, for being with me.